All right.
Good morning, good morning.
Good morning. Good morning.
Are we recording now?
We are recording.
Good.
And we're going to go over my experience, my 3-month experience on PHRT. And we're doing this because a lot of people actually watched and listened to that little podcast we did on PHRT. It was very popular on YouTube and on Spotify and Apple.
And just to remind people or inform people that weren't listening to that one, should we say what it is?
What?
Physiological HRT.
Yes, physiological HRT. Sorry. I'm like, wait, what? Sorry, I'm suffering from seasonal allergies, so not quite 100% today. So,
which is another way of referring to this is a rhythmic HRT that tries to mimic a 30-year-old patient's hormonal cycle.
Yeah. And before we go into my experience, I want to give a little bit of backstory.
Sure.
Because I think it's important to know that I started dating you when I was 42, and at about 44, I started to have really bad symptoms on the second half of my cycle.
Yeah.
And at that time, you were having a lot of conversations with Susie Wiley.
Correct.
About the Wiley protocol. But given the fact that I had a 5-year-old, you felt, with my life being so busy already, that it was a better way to go being on a static dose. And you put me on a static dose of estradiol.
And you immediately felt better.
And I immediately felt better.
Using estrogen and progesterone.
I don't know. Did we do progesterone to start or just we did?
Yeah.
Okay. I can't remember that. But I felt better and I had an ablation. So the period part, I was still getting a period, but I wasn't really bleeding. But
not a lot.
Yeah, but I felt a lot better after that, after going on that static dose. So I've been on a static dose. I'm 60. So for whatever, 16 years. Yeah, for 16 years. So now we fast forward to PHRT and you say, I want you to try it. I was really nervous about trying it because I had been on this static dose and I was afraid to disrupt my life with hormone stuff, but I went ahead and did it.
Thank you.
Yes, because I think it's important. But I had to commit to 3 months. And you said you have to commit to 3 months.
Right.
Okay.
Yeah.
So here we go. My first month, complete disaster. I lost my shit many times in that first month.
I don't remember once.
It was horrible. Some of the things I felt, insane anxiety was probably number one. My nervous system, I felt like somebody turned the burner up to high.
Yeah.
And my sleep was horrible.
Actually, you felt pretty good for the first 8 or 10 days of the cycle. And then when your estrogen levels peaked, which is the whole point of this rhythmic dosing, that's when you hit the wall.
It was bad. And I was traveling, not really traveling. I was just up in the Bay seeing family, but
you weren't at home.
I felt horrible. I couldn't be present with my family because I felt so bad. I was not sleeping. I was sleeping maybe 3 hours a night at the most. And I was trying to just get through it. So I wasn't really complaining a lot to you until until the progesterone part, when the progesterone got really high.
Yeah, you really felt that the sudden decrease in estrogen after the mid-cycle peak stimulated a reaction from your body.
Yeah.
And then it got worse with the progesterone coming up.
And as I started the progesterone, it was fine because obviously I've been on progesterone. That's normal for me.
Yeah.
But as it got higher and higher, twice a day, when I was used to taking the static dose every night, that is what's interesting. But also I was progesterone sensitive way back when I first talked to you about all this when I was 44. I was having a hard time in the later part of my cycle.
Right.
Why are people so sensitive to progesterone?
Some people just are. And a quick question that I ask patients frequently is, how do they feel when they were pregnant? Pregnancy is a high progesterone time.
That makes no sense. I felt great when I was pregnant.
Okay. So I can't be right all the time.
I don't know.
And usually the people that love being pregnant are fine with progesterone. But the levels of estrogen are high also. It's hard to say.
Yeah,
Obviously,
that is hard to say.
That theory didn't work in your case, but otherwise it's still useful information.
Yeah.
How they did in a pregnancy.
So at about day 20, because you weren't with me, or maybe it was day 19, 20, I finally said to you, something's got to give here. I don't know how I'm going to drive home. I was like really frightened about how I was going to get through. My sister was having surgery. What am I going to do here? And you said, okay, cut back, have the progesterone dose, right?
Yes.
Half, 1/2, and just take it at night. And that brought on a period.
Yeah, because it was then suddenly your estrogen had been falling. Now your progesterone was falling, brought on a period, which is not surprising.
But it is surprising when you haven't had a period since I had an ablation.
But you were told.
No, I know, but I had to walk down to CVS at 11 o'clock at night to get stuff. And yeah, that was interesting. And I had cramps and a headache.
Real period.
Yeah, it was a real period.
Yeah.
And then I went through that period of time of the period, also not sleeping.
Right.
Because then I went off the progesterone completely to then day 1 of my cycle, 8 twists or clicks or whatever of estradiol only. And so that disrupted everything for another.
But how did you feel in those few days?
Horrible. I felt horrible because I feel like I got so exhausted that I couldn't catch up. And I had things to do up there. So I wasn't really able to like, all right, I'm going through this and I'm just going to be up here and go on walks and eat well. And no, I was there to get shit done and I had to function. I was working. I was like, so I think that didn't help.
Basically, we changed the program because of your symptoms. And that's an important part of this method is that we document symptoms and we try to relate those to estrogen, progesterone levels and doses so that we can get it right. That's why we talk to patients if they want to try this, that it's got to be 3 months just because we're going to need to juggle. But one of my concerns or problems with the Wiley protocol back in 2000 was that a lot of patients didn't feel good on it. And I couldn't really explain that because I thought this should be fun. It should work for everybody. Of course, it didn't. So I think that these are really personally adjustable and adjusted levels.
Which you did.
Which we did.
Because in the second cycle, I don't know if we lowered the estradiol until the third cycle, but we lowered the progesterone on the second cycle.
Yeah, and we lowered the estrogen too. We didn't take it to quite the same peak.
Okay. But I felt like I was getting the peak.
Yeah.
Yeah.
So just think that you needed lower doses than the normal starting dose that is recommended. I think what I've learned from this is that I'm going to start people on what we call the -2 dose, 2 levels down, because there are basically an infinite number.
Isn't that what I'm on?
No, you were on the initial dose.
Okay.
There's a weaker one. There are actually 2 lower levels, and there are 2 higher levels.
Oh, okay.
But I think it needs to be more personalized than that.
I think it definitely needs to be personalized.
And we need to get the blood levels at certain times. So we can interpret the symptoms that you're having or not having with the blood levels. So it's more work, definitely. But the reason why we're trying this again 25 years later is that I think we realized finally that the progesterone levels that we were shooting for in that original time were too high. And Secondly, there's more data showing that those peaks of estrogen mid-cycle and peaks of progesterone mid-luteal phase are very helpful for the body in terms of combating osteoporosis, cardiovascular disease, and aging. So it's something that patients are interested in. The big turnoff for patients usually with this is if there's a uterus there, it's going to bleed, okay? And that needs to be an accepted part of it.
Yeah.
And if that's the deal breaker, that's the deal breaker. You do something else.
Yeah. That's not, honestly, that hasn't been a big deal for me. It's mainly the sleep, because that's hard for me anyway. But by the time so I feel like month 2 on this was adjusting. Again, it was more of an experiment. I had less days of no sleep and on high nervous system.
Yeah.
Probably about 6 days of that, as opposed to, I don't know what it was, 14, the first cycle. And so I definitely felt better the second month we did it. And then just finished the 3rd month. We're still playing around with it.
Yeah.
And I think this morning we started at 6:30 in the morning with a cup of coffee going over my calendar, which is a sloppy mess. And my doctor was not happy about it.
One of my worst patients, for sure.
It was embarrassing for me, really. But I feel like we're getting to, now we're trying something different this cycle. We're going to have the dosed half 1/2 of progesterone.
You have trouble with the English language.
And there's half and half. And then, so that's going to make me not get a period for a little bit longer, make me go another week.
That's the plan.
Because my cycle's been like 22 days. And so we'd rather have it at 29 or 30 days.
Yes.
So that's the whole point.
Keep tuned.
Yes. But I just want to say that for me, like as a patient, it's been really difficult to do this.
Yeah, absolutely.
And I did commit to it. So I was definitely wanting to see it through. I'm glad I did. I'm going to continue with it.
That was the question.
Yeah. For people that are wanting to try it, just be realistic and do it in a time of your life that maybe you don't have a lot of important things scheduled. Yeah. Where you can be a little more low key if you're having those moments like I did. Yeah.
But thanks for trying.
Yeah.
And
then
we'll continue to
and
learn
my
from
benefits are supposed to be what's supposed to get so much better with this.
Energy.
Basically,
it's strength.
Skin.
Sleeping. Skin for sure.
Muscle.
Yeah. And you can still add in testosterone. Because
no, I've been doing testosterone just once a day because I was concerned that it might be the testosterone that was making me feel.
Yeah.
So I moved to once a day on that. Yeah. So anyway, it's been good. I'm going to stick with it. I'm going to stick with it and see. And then what do we do if we find the perfect dose or
for each individual? Or
yeah,
for
like how there's going to be a range here because some people will do really well on all that progesterone. Right. I imagine they're going to be like, oh my God, I love this.
Yeah.
I'm sleeping so well.
Yeah.
I feel so good.
We actually have already had other patients that are starting on it.
Yeah.
With that reaction.
That they love the progesterone.
Not necessarily the progesterone, but as they started on this, I feel fantastic. I feel normal again.
Yeah. Which is great.
But I think it's a really good method to be used for a woman who is in the perimenopause where the ovaries are misfiring.
Yeah.
They're irregular. So the bleeding's irregular anyway. Mm-hmm. And I think this can safely take them through that time in a beneficial way.
I agree. So. Yeah. All right. Thank you, Dr. Turner.
You're welcome, patient.